In continuing our talking about doctors versus patients, I think I realized just recently that there's a difference in the culture or the way that we think. And it's important to understand the different cultures because otherwise, how can we get along? How can we help each other? Recently, my friend was telling me about what his doctor did, and he, made sure not to disclaim, his doctor, the clinic, try to get in touch with him, this and that. But, it's interesting hearing it from the patient side of things. Because the doctor, I would say, as a doctor, did exactly the right thing. Let me give you a little bit more background. So as a doctor, we like to do things in the proper order. And the proper order almost always means consulting the specialist first, putting that referral before we actually talk to the patient. The reason is referrals take time. They may take a long time. And so it's better if we get it into the queue first, right? If something's going to take, hours, days to run, you might as well get it started now. Then you'll talk to the patient. You have a lot of time in which to talk to the patient before the patient actually gets contacted by the clinic or the specialist comes and does a consultation. So in the hospital, that's what I do. In the morning, when I look through all the labs on the computer, I ask the nurse what happened overnight. I realize some patients need to see a specialist. And so I'll go ahead and page them, put in that referral, and wait for a call back because it may take an hour or two or even longer. Surgeons particularly could be in the operating room and may take them till afternoon to call you back. But you want to be first in that queue because they may have 10 calls to return. And if you're number one, you'll get it sooner, right? And so that's what I do. But sometimes it has just randomly so happens the specialist has time, is able to see my patient that morning. And that becomes an issue because I haven't told the patient yet why this specialist is coming to see them. And they are shocked, surprised, and it's like, doctor never told me I was in trouble. My heart has issues. And yes, I wish I would have told them first, but I just thought that, the specialist wouldn't be by there so quickly. Because just because the patient needs a referral doesn't mean they're sick. And I see the sickest patients first in the morning because you got to make sure they're okay. So here's the thing that happened with my friend. He had some issue, got some imaging studies. The doctor didn't get back to him. The doctor was on vacation, finally comes back. He asked the doctor, hey, so what are the results? And the doctor may or may not have tried to reach him, but anyways, the next day, there's somebody calling from a clinic saying, hey, I want to schedule your appointment. And he has no idea what it's for. What exactly were the results? Is this a good thing? Is this a bad thing? Why are you scheduling me in another clinic? He's very confused. Wants to know what's going on, and I want to know what's going on as well. What were those results? How come we don't know? How come he just put in that referral? How come his doctor didn't get in contact with him first to let him know, hey, this is what's going on, put in a referral, may expect a call. It's all very nice, right? Except it's not nice for efficiency. And that's where the difference comes in because we have a culture of efficiency as doctors. We have a lot of patients. There's a lot of busy people out there. We want to be as efficient as we can. But sometimes it's inefficient to do stuff in this fashion. Whereas you have to contact the patient first. You may have to play phone tag for a few days before you put in that referral. That's going to all delay treatment. That's not what we want as doctors. And that's actually not what patients want. But I think more importantly, patients want to be kept in a loop. They're the patient. This is their body. They want to know what's going on. And I think it's very reasonable. I think that's a big difference between doctors and patients in the way they think. And so I think next time when this happens to you, be a little bit more understanding because your doctor thought he did a great job. He's like, oh, I definitely jumped that queue. I got that appointment sooner than I would have thought. And you, by criticizing him, by being upset, it's like saying to a little kid who's worked so hard to make this beautiful sandcastle, and it doesn't really look like much, right? But if you criticize a little kid, how's the little kid going to feel? Is the little kid going to work harder to make a sandcastle next time? Of course not. The little kid is saying, what's the point? I'll just take my sweet time, try to call the patient, can't reach them. Oh well, right? We'll keep on waiting. Maybe it's going to be a week until I put in a referral specialist. Maybe the specialist by then gets overloaded. Not my fault. As a patient, you may not know any better, but basically your doctor's sort of given up. And that's not what you want either, right? So I think this is a little bit of the difference in doctors and patients, and I'm trying to help you understand sort of where doctors are coming from, because I think most people understand where patients are coming from, because they're the patient, except for doctors. And that's sort of our problem. And unfortunately, we don't really go through a lot of medical issues ourselves, and in a sense that makes sense, because as doctors, you want a doctor who's out half the year, right? But I think it is a downside that doctors don't suffer through the same things. But I think this will help us so we can work together, we can understand each other, know where we're coming from, know what language other person's speaking, what's going through their mind, what their priorities are. And that way, we could all work together to come up with a great plan and keep the patient in the loop and make them feel like they're well taken care of.